vai refletir e nos trazer o trabalho tão bacana desenvolvido durante a pandemia.
That's made during and before the pandemic there on Guiné-Bissau. There were also Dr. Candida Medina and psychologist Dilma Alves Spencer. Both of them couldn't make it today because of health issues and location issues without the internet. So Finhamba Quessange Silva, licensed in psychology and also psychology from the Center of Mental Health, Maxima Massogueira. She works with psychological support from the No Borders doctors. She's a technician from Caritas. She's a responsible psychologist on the regional program on reducing damage of HIV and others comorbidities. And she also works on promoting the human rights of injected drug users on 5 countries on Africa: Burkina Faso, Cabo Verde, Mauritania, Guiné-Bissau, and Senegal. Finhamba has also participated on the formatting supporters on psychology supporters on the Finhamba, it's now your time to speak. I ask you to speak slowly to help the translators. Thank you, Marcia. Good afternoon, everyone. I am Finhamba Quessange Silva. I am psychologist here on Centro de Saúde Mental João Damasio Feira. I'm here today to share a little bit my clinical experience on the pandemic time. It's good there, Marcia? As the project of pediatric emergency has come to an end, as I was saying, I worked with the health professionals that work with MSF. There are no borders doctors here on Guinea-Bissau, Doctors Without Borders. The project has come to an end. The pediatric emergency project has come to an end. And this project was a Doctors Without Borders project that lasted for 4 years. Unfortunately, it ended on July of this year. So this project coming to an end, and the current pandemic we realized that the MSF team was more exposed to the stress factors that can lead to hard situations that affect the well-being, the personal well-being, and their correct. So on this sense, the possibility to have some space and time to analyze the things that they have to face day to day, so they can face them better and minimize the impact on their health, on their mental health. We have here the context, some demographic data about our country. Guinea-Bissau has a surface of 125 square kilometers, so you can see it's a very, very small country if I compare it to yours, Brazil. We have an estimated population to 2020 of 1,645,000. According to the National Institute, 2020. The geographic situation on the north is the Republic of Senegal. South and Southeast is Southeast, the Republic of Africa. And to the west is the Atlantic Ocean. So we have two climatic seasons, the dry one from November to April, and the rain stage is the rain season that's from May to October. So now some epidemiological data. The first cases that came the 25th of March from COVID. At first, there was a ministerial condition. Agora tá. So the first cases that came were notified 25th of March. There was a a ministerial commission whose technical work was supervised by COES. COES means Center of Operations on Health Issues, health emergencies. So, between March and July, it was the peak period. Today, there's a total data. The total of cases is 2,325. The people that has recovered is 1,728. Deaths, we have 40 by COVID. So let's talk about the context of Doctors Without Borders. They maintain a project with the only third-party health institution on the country. That's the National Hospital Simão Mendes on the capital, that is Bissau. That's focused on the children health. They do the pediatric emergency administration. They also do neonatal intensive care and pediatric care. Meningitis, dysentery, and lack of breath is the main health issues for the infant on Guiné-Bissau. Asepsia and lack of breath are the main health issue, main death from the recent born. UNICEF works with the Minister of Health to guarantee that the health protocols are correctly being held. So to reduce the infant death. MSF has seen a rise on the number of people infected between the days 14 and 30 of April. So in just 2 weeks, the city of Bissau, with 250,000 people, is the epicenter of the pandemic in Guinea. According to Monica Negretti, that is responsible for MSF on the country. This rise, the exponential rise on the contagion, shows that the virus is still spreading on the communities. Although there's the authorities have adopted some ways to prevent the spread, it's still spreading. Another issue, alarming issue, is that a great number of health professionals from the main hospital in Guiné-Bissau that is the national hospital in Simão Mendes, are in quarantine and can go to work. Also, according to Monica, the lack of recognition from people about the disease on the country makes the issue worse and complicates any possibility to prevent the spread of the pandemic. Negretti proposes that the professionals of the health professionals these professionals that are on the front line, they should have the ways of their self-protection, the resources. This project has as an objective to work the well-being of these health professionals, the emotional well-being of these health professionals, to prevent the mental health problems that could come from the work. To make the structures for facing the issues by the team better, to treat the health issues, the mental health issues that are intimately related and directly related to the work of MSF or the exposition to COVID-19. This work was realized on a period from May to July 2012. It was 3 months period. We use the participative methodology. We call it Jumbai. Jumbai, in the local language, is a chat room that we can share. the works were being done like that. Group sessions for 1 week each month for 3 months with different groups every day. These groups were constituted from the administrative people, the nurses, the doctors, the cleaning staff, the drivers, and people from the high risk factor, so that we could make a space to share the experiences and the feelings related to COVID-19. And work on the end of the project to understand and identify the issues or health events in general. Like a grave illness or some death on the family, losing a job that's contributing to global stress, and the deterioration of mental health. To improve and make stronger the capacity of facing the hardships of the team. To share the confrontation mechanisms between the members of the teams that were being well used by people. To present or reinforce these abilities for the members to be able to handle the traumatic events better, and abilities to reduce problems. To enhance their sense of control and pleasure in life. To track people that has some difficulties with a tracking formula. Me as a psychologist, one time at a month, per month, we're leading group sessions. Yeah. Show your face, please, so we can see you talking. I think my face doesn't want to show. Hello. There. Yes, that is good. To introduce or improve confronting abilities that can capacitate the members in the face of possible traumatic events. And abilities of problem solving. Improve their sense of control and pleasure in life. to track people with more difficulties using the tracking formulary. A week on each month, the psychologists make group sessions, at most with 15 people from different areas. The psychologist presents a descriptive letter about her work plan to the group sessions. And the medic department, together with the health resources department, the human resource, prepare the lists and go and make contact with the psychologist. The psychologist has a time to work with different people from the project. The medic department also follow up on the sessions. And there was also an individual support on demand. The psychologist has a goal to identify group sessions on the week, the professionals that requires an intervention or individual support. The professional can also ask for the support, be it on that group session or by telephone. On the first contact, the psychologist, the psychologist report each person that has had individual support each month, each worker, each professional are entitled to a maximum of 5 individual sessions. The attention should be given to the work issues or about the issues about the COVID exposure, be it direct or indirectly. The clinical contribution by the psychologist and then the on-demand and this on-demand solicitation of individual support, 9 people has asked for that. Group support were made 15 group support in these sessions. 147 professionals has participated from different categories. Doctors, nurses, cleaning staff, drivers, laboratory technicians, and the professionals that were on the health risk for the COVID. This group support has an objective create a space to share feelings and experience related to the events. to understand and identify issues and events from life in general. Okay. Mutou, a Finhamba está mutada. She's muted. No. Yeah, now I can hear. What didn't you get? As I was saying, clinical contribution. I told about the individual support. And people were attended. And then I talked about the group support. 15 sessions where 147 professionals took part from different categories. And the support of the group has an objective to create a space to share experience and feelings related to the events. Understand and identify problems and events of life in general. Like a grave illness, death in the family, or the losing of a job, or the deterioration of mental health. To improve the potential and natural capacity of the group members, of the team members, to overcome hardship, to share confrontation mechanism that has been useful to people. To introduce or reinforce capacities that can empower members in the face of potentially traumatic events, and the health and the problem-solving abilities. And raise their sense of control and pleasure in life. With that work, I learned a lot. So, as learned lessons, we know that things can't be as they were before, for now. But we can adapt to these changes that were imposed to us, and build our life with new lessons. was a gratifying experience to make this work. It made us research on the internet, read and talk with various health professionals from different areas. Why? We know that COVID is a new thing. It's a new thing for us here on Guinea. So I tried not only to understand the professionals here, but also the professionals from the diaspora. Like I told you, the first cases were 25 of March. On other countries, they were facing it for more time, so people with more knowledge related to that. So to make this work with the MSF professionals, I had to go find out on internet, to read, to talk to other professionals, trying to see and understand this pandemic. With this work, I learned and I grew a lot as a professional. This was my work. Thank you, everyone. I can share with any of you that some of people want ask Marcia. I can share this paper. I can share with you. I can share my text if you want. Thank you. Thank you, Finhamba, for your words and text to present your country and the work that's so nice that you make together with other colleagues and other professions. We have some questions already that came by chat or Telegram. I will ask you, and after the translators translate it, you answer, okay? So, question from Sinelli Valley from Rio de Janeiro. Finhamba, a pleasure to meet you. I'm grateful for you to share your activity. It's a nice work. How do the psychologists took care of their own mental health so they wouldn't grow ill during the pandemic? This question is to think about the complexity on the field of the health worker complexity. Because us on the health area are not free from getting you, not safe. Thank you for the question. I work in a mental health center, so there we are 3 psychologists. There was this, we were always careful, not only with the psychologists, but with all the professionals there, social assistants, doctors, nurses. There's a program that's being developed that is to taking care of the carer. We have that in mind, not only on this pandemic time, but also because we deal with people, different people, we can say. So it's not easy. And we have to take care of our mental health so we can be able to take care of other people. Or if we're not too well with ourselves, we won't be able to take care of other people. I also have been attending these meetings, not only as a psychologist, but also as a psychologist,
Preciso cuidar da minha saúde.
Not only as a woman, but also as a psychologist and a mother. I'm sorry, my audio had a little problem, so I couldn't translate some part. Jumbai is the name of this speaking group. Is the place, the moment that we have to share. It works like a group session. Because the psychologist is still seen with a little bit of stigma. When you tell a person that she needs a psychologist, automatically most of the people, even though those, let's say the enlightened people, they immediately respond that they are not crazy, that they don't need psychologists. Unfortunately, still, we are facing this kind of issues. And we are also not with our arms crossed. We are making an effort to change this way of thinking. Using the data and also explaining what is a psychologist and what's his work. Trying to explain that psychology is a transversal area. That everyone needs, be it to make an orientation for the adolescents and kids, be it for couples, be it for professionals. To try to understand that psychologist is not for people, crazy people. That is being our work here. And we have created a psychologist association. It's still in the embryonic phase. It's going well. And we have registered all psychologists that are existing on the country. We are 30 We are 30 on the country, 30 psychologists on the country. We are few, but for a small country like ours, and the population that we have, and we don't have a psychologist course here in Guinea-Bissau. And we know that psychology is not for everyone. It's an elite course for the elite people. So all psychologists that are here today, the 30 of them, all of them studied outside, including me. I did my studies in Brazil, in the Catholic University of Petrópolis in Rio de Janeiro. Like me, there are others that were formed in Russia, Portugal, United States, and other countries. Because here we don't have a psychologist course. So to make it happen has to be very, very well funded. And not everyone has the resources to go outside and study psychology. So many people manifest that they want to make psychologists, but maybe, who knows, maybe someday we have more psychologists here, because here we need them. Our culture in a country that till now there's a lot of things to be explained and understood at the psychology level, to be demystified, is complicated because of cultural questions. But we are working on this sense. I hope to have answered the question from our friend. We have more questions. So just an observation. The situation of the psychologists in Brazil is similar to the one in the beginning. So many people still think that psychologists are for crazy people. It's not so different, even though we are in Brazil 150,000 psychologists. So the question from Claudia, Aline Monteiro from São Luís do Maranhão, the Northeast. Very nice to see many similitudes with the work we do here on the community health work. I'm inspired by your speech. What's the necessary formation inside or outside psychology for a psychologist to work on community work during the pandemic, for example? What is the necessary formation for a psychologist to work in community health during a pandemic or a big event like that? If there is any specific formation for the psychologist to work. I don't think there's a specific formation for that. Mainly talking about this pandemic, it's a new thing here. We were not prepared for this. But as we face this situation, we have to face it the best way we can. And it was what I did. During my presentation, I told you that I didn't knew anything about COVID. So what did I do to keep up with it? I had to dedicate myself. I had to go online to search for it, research and read and talk to other people, talk with other professionals that are a little bit more informed. Because here it were happened in March, but the pandemic didn't happen in March. I had to talk with people from Brazil, Portugal, Spain, that they had more cases that were already working with that. So I lost count of all the supervision as I did with other psychologists and professionals also, nurses and doctors, to try to understand, to try to gain knowledge. Because what I knew to them were only the issues of how was the transmission. So I went to search for it. So to that you need to want it. You need to want. You have to the wanting to help. It's what is understood on the person-centered approach. Empathy always. Empathy always. I don't have any specific formation to act on the calamities, and I'm on Africa and Guinea-Bissau. We have the Ebola. I had to work as a psychologist. I also knew nothing about Ebola, but I worked with the Spanish Red Cross, giving psychosocial support. Which I studied it as a psychologist. Because on my formation in Brazil, I was always working with the communities there. I was a volunteer on a non-governmental foundation in Petropolis. I came to know about this work of this organization from a colleague that today I consider my brother, that is Antonio Carlos. He is the responsible for that organization. I was on the same class as him. He told me about their work. I volunteered myself and went there. I worked with them for some years and I fell in love. It was an organization that took care of people that had the HIV, and I always liked to work with the community. I was volunteer on that with some people, with the friends from the autism group. I was also volunteering for the old people home. Till the day of my graduation, the municipality politicians gave me a recognition, and on the day of my graduation, being a foreigner in Africa, they should make this motion of thanking me for all the volunteer work I did there. I have a good relation with the people there from SOS Vida. I talk to them constantly, and also some colleagues from the university that work me with there. I also work other institutions. I worked with deceased priests there. I always enjoyed that. I didn't see why I would make different in my country. That's a country that really needs it. It's a poor country in all senses of the word. I don't think there's a formation. To my understanding, there's no formation to act during a calamity, this pandemic. These things are always, you can't predict it. It just happened. None of you wanted to see this pandemic happen, but it happened. We have to adapt to the reality. Everyone has to do their part the best way they can. And it was what I did. A little more questions. I student a psychologist from Rio de Janeiro that thanks you for sharing your work. And she asks if you saw any hardships. There were some resistance from the health professionals to. So the question is, if you saw some resistance by the health professionals in understand the necessity, the need to receive this psychological support that you were talking about. It's nice for you to ask that. I saw that the doctors mainly, and they are, I see them as a little bit of mechanicists. They are really resistant about psychology that you can't even fathom. They don't think it's needed. They don't think they need the support. But it was impressive. So just also you can realize it, the Doctors Without Borders was worried about the situation about the situation of these professionals. Not only the doctors, but the nurses and all the staff that made part of the MSF team. So coming by this issue came the idea to hire a psychologist to be able to to give this psychosocial support to these workers, but they, instead of being able to take part on the support being offered, they didn't do that. They ignored it, thinking that they didn't need it. If you realize it, there were only 9 people that made the individual support. Only 9 people took advantage of that, where there were 200 and some workers on MSF. But we can see a very, very different. They had the right for individual support or the group sessions. But so you can see, but to have the rights for this individual support, that person had to manifest the interest in have that support. They didn't want it. No doctor took place on that individual support. They only took place, they only participated on the group sessions, because on group sessions, it was different. There were more people, more professionals. So as it was a place for sharing, they felt a little bit more at home initially. None of them were talking about their fears about COVID. Those issues were initially presented by the cleaning staff that were worried because they felt more exposed, and they didn't know much about the issue, the illness, and they didn't know how to deal with that situations. Anxiety. Nobody knew when it was going to end. There were people from the risk group also that were being forced to work during the pandemic, because 14 days later, after the first case, there was a contamination chain where most of the health professionals were infected and had to go in quarantine. So the other people that were there had to cover up the situation. So they had to work, being or not from the risk group or not. So nobody asked if they wanted to go or if they could go. They didn't have that condition. They don't have that choice. They had to go to work, and that's it. On that peak period. So we didn't really use the project. The project was coming to an end. This intervention period was from March to July. Only at the end of the project, when they began to really value it, it was already too late, because we were at the end phase. And today, I am receiving some calls, and these professionals are asking me that before they didn't want, because they thought that they had everything under control, but now as we see that pandemic hasn't come to an end, it's being hard. But now they are not receiving everything free now because MSF was funding everything. Each professional had the right for 5 individual sessions, but at the time no one wanted. But now the project is over. And they only realize the importance of the support late. But they realize now that it's a little bit of resistance. Even though there are people that we say that are enlightened, they are a little bit hesitant about psychologists. Not only during pandemic, I have seen that, but on the course of all my history here in Guinea. Even for a doctor to send patients to a psychologist, even though he knows that the patient needs it, it's not easy. Sometimes they do it late because we have a lot of cases of post delivery depression and some situations that need a psychology support. We have the situation of early marriage. These little girls sometimes come. Some of them can flee from these relationships. They go to the houses of some relatives or some helping houses. And in these situations, we have to have this support for these women, these young women. But not everyone understands that it's really needed, that this psychological support is needed. They think it's a waste. Why do I have to go and pay a psychologist if I have a friend that I can talk with? Or a priest or a preacher. They think it's a waste to pay a psychologist to be there to talk with you. Because they want everything for now. They took time to look for it, and when they look for it, they don't have patience, even if you explain everything and how it works. But they don't want to lose time. They want to come and do everything very fast, but it's not possible. We know that in psychology it's not like that. I hope I have answered your question. Question from Emmanuel Meirelles from Fortaleza. Finhamba, many people in chat are very satisfied to hearing you, to listen to you, have identified a lot with your work, and are very happy to many people commenting on your work. Emmanuel says it's a pleasure to listen to you, and asks if these conversation groups are methodologically fundamental on the ACP, or are they, or do they use other theoretical fundamentals. So I'm going to repeat the question. So he asks if the conversation groups are structuralized on the PCA framework or other theoretical methodological references. I explain that I study on Petrópolis, Brazil. In all my formation, I was oriented by psychoanalysis. Most of my teachers, not to say every one of them, were psychoanalysts. So I can't really, I'm gonna be very truthful with you. I can't really flee from psychology, from psychoanalysis, but I'm starting to like this person-centered approach from an early. It's not very. It's a very recent thing for me. It's thanks to a friend of ours that's Mirella. It was Mirella that has been presenting me and starting to make me fall in love with PCA. But before that, everything was psychoanalysis. I'm sorry, but I'm not very. It's the PCA thing for me is a very early thing now. It's a very recent thing. I'm working a lot, but these group chats were more centered on psychoanalysis way of doing. Why did I adopt that? Since we have this resistance from the people, we have to realize that we have to respect them the way that they are, so we can try to do our work. If we go to the individual support, I'm not gonna say that's not gonna happen, but very, very few people is gonna look for you by personal initiative. So we decided to do these group sessions because there we could share, so they can realize that that's a problem for everyone. That fear for COVID it's common, not only for the drivers, for the administrative staff, for the nurses, but also for the doctors. Even though they think that they thought that they had everything under control, that they didn't need the psychological support. But they are a little bit mechanicists, so it's their way of being. So I'm sorry. But during that work and my formation was always psychoanalysis. Today, thanks to Mirella, she came here to Guinea about 3 times. She did this formation on PCA. So I think we will continue to work on that, since I identify myself as a member of the ACP family, the PCA family. So you can I didn't forget the norms of the PCA, but sometimes we have to use other resources to reach our goals. The only way that I found to give and they accept this support was using that group chats with Jumba. But in the end, works like a encounter group or anonymous alcoholist group or a group of mothers. A support group. So that the person can realize the issue that they are facing, other people also face. So sharing these pains and issues, you can reach a better result. Thank you. I'm gonna end here. Some observation and questions. Another question from Maria Rocha that asks, how do we have our contact and be a volunteer to act with psychologists there on Africa? There's someone that has an interest in work there on Africa. As I said, to work here in Africa, here on Guinea-Bissau, Africa is too big for me to speak about, but here on Guinea, I'm only here on Guinea. So I will talk about Guinea, where I am. I am psychologist here on the mental health center. I can give my contact, email, telephone. I think it's not only the mental health area, but there's a huge need for a psychologist to work here in Guinea-Bissau. So the doors are open. We need more collaboration. And when it's in a volunteer form, it's better. So you are welcome. I'm gonna leave my email, my WhatsApp. If she wants, she can come in contact with me. And I can reach other institution. It's not only here. There, okay, she's welcome. But we have other institutions, more places that need. And I thanks for her goodwill to help the people who need it. That sharing is very good. To help us recycle and everything, who knows? Maybe we can reach all these professionals. Thank you, Finhamba. Since you authorized, I'm gonna give your email and WhatsApp. And if you want to give your text, I'm gonna give you this final version of the text. I'm gonna give you the email with that text. I authorize you to share this text with the ones who want to see, the people who wants to know about the Guinea and the work of psychologists here, other possibilities, like our friends has asked about how to help us. We are willing. And I thank you for the opportunity. Another time, thank you, Marcia, for the invitation. It was a pleasure. So, Finhamba, I thank you a lot. I was moved by your reflection and the impact that your reflection had on the people here seeing. Right now we have 241 people. We had more. And there is a lot of messages about the positive impact that your reflection brought to these people. So I'm thankful that you came here. I would like to register the presence of Professor Candida Medina. I saw her face here. She was ill, but came here to enlighten the event. So being the time and we have a break for lunch, it's gonna be a little bit longer than we